Well, good afternoon, everyone, and welcome. My name is Jason Kopping, and I'm delighted to be here as the MLA for Calgary Varsity. We have a very busy agenda this afternoon, so I just wanted to say how much I appreciate this announcement being made at the Foothills campus today. Calgary Varsity includes the University of Calgary and Foothills, and this is one of the most critical healthcare facilities in our province, serving families across southern Alberta and across all western provinces. I'm honored to be here with my colleagues, Minister Shandro and Minister Panda, and I'm looking forward to hearing from some very special guests. So I'll ask Minister Shandro to kick it off. Minister Shandro.
Well, thank you, Minister Kopping, and good afternoon, everyone. Thank you for joining us today for this announcement. And I'm delighted to be here with my colleagues. As Minister Kopping said, we're joined by the Minister of Infrastructure, Prasad Panda, as well as Minister Kopping, as I said, he was not only the MLA for Calgary Varsity, where the Foothills campus is, but also the Minister of Labour and Immigration. We also have some other special guests with us today, as Minister Kopping said. We have Dr. Ted Braun, who is the Vice President and Medical Director of Clinical Operations at Alberta Health Services. Thank you to Dr. Braun for joining us. We also have Mike Meldrum, who is the CEO of the Calgary Health Foundation. And most important of all, we have Molly and Patrick Wilding and their daughter Gianna. And this day is about them. And it's an honor to have them here with us today. We're committed to maintaining a world-class, publicly funded healthcare system that's there for Gianna and all Albertans, and when they need it and where they need it. To deliver on that commitment, we need state-of-the-art facilities. Through Budget 21, we're investing $3.4 billion over 3 years in capital funding for health facilities, equipment, and information systems. And with this funding, work will continue on existing major projects, and that includes the Calgary Cancer Centre, the Jean Zwazdesky Centre at the Norwood in Edmonton, and the new Southwest Edmonton Hospital as well. And today, I'm very pleased to announce that we've also added $143 million in Budget 21 for 5 new projects. Here at the Foothills Medical Center, we're investing $23 million, plus a significant contribution from the Calgary Health Foundation to add 19 beds to the neonatal ICU unit. Now, the NICU here at Foothills serves Alberta's smallest, our most fragile patients. It's one of the busiest in the country, and in fact, you can see it from here. It's up on the fourth and fifth floor, is it? The fourth and fifth floor? Well, fifth and sixth floors. Now, once completed, the new beds will look out over this courtyard, and this is the only NICU in southern Alberta. The skilled staff and the skilled physicians care for the most fragile newborns, many of them born to moms who needed high-risk deliveries. And those moms and those families often know the risks they're facing from early on in their pregnancy. I have 2 kids of my own, but I can't imagine what those families go through. And I have the deepest admiration for the staff and the physicians who work at this NICU. They provide expert care to the newborns, but they do so much more than that. They care for the mom, and they care for the family as well. They become extended family. In many cases, the bonds last years, or in some cases, a lifetime. And I'm here to announce capital dollars for construction, as well as machines and equipment. And those things are essential, but they are, just remember, they are just tools. The real story, as always, is the incredibly caring people who work in the NICU and everywhere in the health system. But they do need this investment. Make no mistake, the NICU is frequently 90% full, and Calgary, as we know, is growing, along with the rest of southern Alberta. There are about 20,000 babies born every year in Calgary, and 10 years from now, that could be as high as 31,000. So this project means one simple thing. It means that the people in the NICU will be able to continue to deliver on their promise of world-class care to every newborn who needs it. And I'm very proud to support them in doing that. In a minute, Mike will say a few words about the Health Foundation support for the project. I also look forward to hearing from Molly and Patrick. But first, I'll just say a word about the other new projects that we're funding in Budget 21. We're committing more than $18 million to give Calgary its first cyclotron and radiopharmaceutical manufacturing facility. So a lot of words and a lot of syllables, but this means that Calgary will have its own supply of isotopes for nuclear medicine treatment and diagnostic tests, for us to be able to have the ability for isotopes. And for those of us who are aware of the importance of the need for isotopes to be manufactured close to where they're going to be made or used, because they have a half-life that rapidly declines. Right now, the isotopes are made in Edmonton or elsewhere and get shipped to Calgary as needed. And because of these short half-lives, often only 25% of the product survives that journey. With a new facility, Calgary will have its own supply, and other centers will be able to use their supply more efficiently. And this technology will be a boost to the new Calgary Cancer Centre, slated to open to the public in 2023, ensuring that folks in Southern Alberta have access to state-of-the-art care. We're also supporting a new project at the Rocky View General Hospital here in Calgary as well. With $59 million in new funding, the hospital is redeveloping as well as relocating the ICU and the coronary care unit to a single, expanded space with 25 private beds. And in Northern Alberta, we're providing $35 million to build a new, larger, more integrated community health center in Lacrete. The government and AHS have been working closely with Lacrete for more than a year to identify the healthcare service needs and the gaps in the community. A new consolidated health center will provide quality maternal care to the growing community, as well as space for mental health services and more primary care from family doctors and other health professionals. And finally, Budget 21 is providing $8 million to demolish the old hospital in High Prairie so that the land can be developed for future opportunities. Now, the community has been asking us for this for years, asking previous governments as well for years, and we're pleased to support it. All told, capital dollars from Budget 21 will support projects to serve rural and remote communities and build programs and services most needed by the province. Budget 21 is investing in protecting lives and building Alberta's health system and its health facilities to meet the needs of Albertans now and into the future. I'll now ask my colleague, Minister Ponda, to say a few words about how these projects are supporting jobs and the economy here in Alberta.
Good afternoon, everyone. Thank you, Minister Shandro, and I'm happy to be here together with my colleagues, Minister Shandro and Minister Kopping, for this important announcement here at Calgary Foothills. And thank you to Alberta Health Services and Calgary Foundation and everyone here today for taking time to join us at this important announcement. And Foothills is certainly a buzz with construction activity. There are several projects already underway here with the Albertans at work. Minister Shandro told us about the Budget 2021 protecting lives here in Calgary and around our province. When construction is finished, these vital healthcare projects will positively impact us for many years to come. However, in the short term, the construction of these facilities will also protect the livelihoods of many Albertans directly and indirectly. Through the funding for these 5 projects, we are expecting to generate 800 good jobs. And here at the Foothills, it will take an estimated 130 skilled workers, including electricians, farmers, framers, and painters, to expand your neonatal intensive care unit. The new cyclotron and radiopharmacy facility project, also here at Foothills, will need an estimated 100 workers to complete. The redevelopment project at Rocky View General Hospital will generate around 330 jobs. Building the new community healthcare in Lacrete will bring an estimated 200 jobs in that smaller community up north. And 45 Albertans are expected to be employed for the demolition of the old High Prairie Health Complex. And though it is not new, I would like to point out just over there the Calgary Cancer Center. There are about 1,000 Albertans at work on site there every single day, and that huge project remains on time and on budget. I would also like to remind other projects we are right now doing at Peter Lougheed and Rocky View, and also last week myself and Mr. Shandro announced construction kickoff for Bridgeland Long-Term Care Center. So right now, with this announcement today, we'll have almost $1.8 billion worth of healthcare capital projects under different stages of construction. And those projects have created and will create almost 11,000 jobs here in Calgary. And the positive impact from these projects will ripple out from the worksite to benefit local manufacturers, suppliers, and trucking companies. The jobs created by these projects will be primarily in trades and trades-related industries, but the impact will not be limited to the construction site because there are architects, designers, engineers working in downtown Calgary and other places in Alberta, and the financial benefits will reach the local community. Local businesses should see increased traffic. As the project teams travel to work in the morning, they will stop for coffee and fuel. They will eat at local restaurants for lunch. They will shop at local grocery stores on their way home. And these projects mean that contractors can hire staff instead of laying off workers. And these projects mean that more skilled Albertans will be able to work their trade instead of collecting employment insurance. These projects mean more lunch orders at the local sandwich shop instead of empty tables. For every job these capital projects generate the lives and livelihoods of many Albertans will be supported. By investing in these healthcare capital projects, we are investing in Alberta and Albertans. And I'm sure my colleague, Minister Kopping, the local MLA, will be happy to see the construction activity in this area. And I look forward to seeing hard hats and work boots at each of these project sites. Now, please welcome Dr. Ted Braun to the podium to speak on behalf of Alberta Health Services. Thank you.
Good afternoon. Thank you, Minister Panda and Minister Shandro. My name is Ted Braun, and I'm the Vice President and Medical Director for Clinical Operations for Alberta Health Services. And it's my privilege on behalf of the AHS Board and our President and CEO, Dr. Verna Yu, to join you in celebrating this remarkable investment in healthcare. As we heard from Minister Shandro, today's announcement will touch the lives of Albertans across the province. This investment in improving the quality of care in Alberta will pay dividends for years to come, starting with our most vulnerable, premature newborns, where the need for services is always significant. The Foothills NICU has one of the highest admission rates in Canada and provides treatment for those babies who require the most intensive of care. As Southern Alberta's only newborn Level 3 NICU, this unit manages all high-risk obstetrical deliveries and cares for newborns from across the province who require this care. It's a critical resource for thousands of families in the province. And thanks to the investment announced today, we move closer to achieving our goal of substantially increasing capacity at the current NICU. Thanks in large part to the support and leadership of government and our community partners, we will offer hope and healing for more babies and families who need it. We will also enhance the patient experience for residents in Northern Alberta by expanding access to maternal care, mental health support, and primary care with a new health centre in Lacrete. Patients in central and southern regions of the province will benefit from the new cyclotron and radiotherapeutics manufacturing facility here at the Foothills. These resources are essential components to the treatment of cancer patients and in the diagnosis of cardiac and neurological disorders that we expect will result in more timely care and greater efficiency. And a new joint intensive care and cardiac critical care at the Rocky View General Hospital will expand capacity by almost 50%, offering treatment space that will serve critically ill patients and their families in and around Calgary. Delivering world-class health care to more than 4 million people from all walks of life does not happen without deep collaboration. It demands strong partnership between government, providers, philanthropic organizations like the Calgary Health Foundation, donors, and our community. In Alberta, we are very fortunate to benefit from these partnerships because they directly impact AHS's ability to offer high-quality care where and when it's needed. Partnerships help make our health system the best it can be by enhancing our technology, our treatment spaces for patients, and by empowering our skilled healthcare providers. Community partnerships also enable us to further develop innovative ways to deliver patient care and to conduct important research that improves healthcare safety, quality, and value. So whether it's a new family in Southern Alberta experiencing the uncertainty of having a baby in the NICU, a cancer patient relying on access to timely treatment, a loved one who has experienced a traumatic injury, or an expected mother in Northern Alberta requiring mental health support, today's announcement is an assurance that along with our partners, AHS continues to deliver patient-focused, quality healthcare that is accessible and sustainable for all Albertans. Finally, I would like to extend my gratitude to all dedicated physicians, staff, and volunteers at AHS who continue to work tirelessly over this past year despite the enormous challenges. Thank you for all your commitment and ingenuity. Your tremendous resilience and unwavering compassion are truly inspiring. I know I speak on behalf of Dr. Yu and all of AHS executive leadership when I say we are very proud of what we have achieved together, and not just during the pandemic, but over the past decade. Along with a well-earned reputation for excellence in clinical care, we are also one of the most innovative healthcare systems in Canada. And with today's announcement, we ensure that that legacy endures. It is now my pleasure to introduce Mike Meldrum, the President and the CEO of the Calgary Health Foundation.
Good afternoon, everyone. Thank you for the introduction, Dr. Braun, and also to Minister Shandro, Minister Panda, and Minister Kopping. Thank you for your commitment to advancing neonatal health in the Calgary zone. We're excited to partner with you on the Foothills NICU redevelopment. Sooner or later, and often unexpectedly, we all depend on the healthcare system. And when that happens, we want the best possible outcome. This is particularly true of parents of the 1 in 8 babies born in the province who require specialized neonatal intensive care. I know this firsthand from my experience 23 years ago when my son Levi was admitted to the Foothills NICU for specialized care. Levi enjoys a great life today due in part to the exceptional care he received right here at the Foothills. Canada's busiest NICU is here at the Foothills Medical Centre, supporting our most vulnerable patients, our infants. Built 25 years ago and oversubscribed due to the Alberta's higher than average preterm birth rate, it's the focus of our $66 million Newborn Needs campaign. While Foothills NICU care outcomes are among the best in the country, the existing space cannot accommodate the innovations and best practices available for today's standard of care. We also know more can be done for women's health to reduce the risk of preterm births and adverse perinatal outcomes. Our mission is rejecting the status quo, and Calgary Health Foundation supporters are motivated to change the statistics for Alberta's babies. Through this collaborative investment with the Government of Alberta, our community will ensure newborns have the best possible outcomes by redeveloping and expanding the Foothills NICU, funding family-centered care initiatives, advancing women's health, and investing in research to prevent preterm births. As our past board chair and Newborns Need campaign advocate Bill Sembo notes, if you've met a family who have experienced an early birth, you'll understand the importance of this initiative. Our 3 campaign co-chairs, mothers representing 3 generations of Calgary families, volunteered to champion this appeal for that very reason. Today you'll meet Molly and Patrick Wilding, who graciously agreed to share their family's 90-day Foothills NICU experience with us. You'll hear how extraordinary care saved their premature daughter's life. And while the family is extremely grateful for Gianna's progress, imagine how impactful more research into the prevention of preterm births, expanded NICU capacity, and advances in perinatal care will be for thousands of parents like Molly and Patrick in the years to come. These breakthrough investments will transform lives. That's why many local supporters have already contributed to the Newborn Needs campaign. We're 3/4 of the way towards our $66 million fundraising goal, and we need your help to send more babies home from hospital sooner. Nothing less than the most progressive neonatal care in the world is acceptable for Alberta families. Please join us in ensuring every newborn has a fighting chance. Thank you. Molly and Patrick Wilding, joined by 1-year-old Gianna, will now share their story.
Hi everyone, my name is Molly, this is my husband Patrick and my daughter Gianna. Gianna was born January 2020 at 23 weeks and 6 days gestationally, which means she was born about 4 months premature. She was born this early due to a pregnancy complication called incompetent cervix, which no one could have predicted. I have none of the risk factors and no symptoms leading up to this diagnosis. The doctors discovered what was happening after a routine ultrasound at 19 weeks, and I went into emergency cerclage surgery that night. Immediately following, I was put on bed rest, which gave us an extra month before she was born. We were in shock. Before this, my pregnancy, my first trimester, was uncomplicated, to say the least. I was a healthy woman. Why was this happening to me? We spent most of that time in bed rest in tears because we were presented with the outcomes of what being born that early could really mean for us. And when Gianna was born, we were scared out of our minds for our daughter's life and her to survive. When she came out, all I could say on repeat was, so tiny, so tiny, so tiny. And she was. At birth, Gianna weighed 620 grams, which is 1 pound and 6 ounces. She was only a ruler long. We spent 149 days in the NICU following her birth. 97 of those days were here at Foothills NICU, and the remainder at Rocky View. Foothills is the only NICU in southern Alberta equipped to care for babies who are born at Gianna's extreme premature gestation, which means it's incredibly busy and often over capacity. We witnessed so many families enter and then get moved as soon as possible to a different NICU site because of the lack of space at Foothills. The NICU staff at Foothills walked us through so many heart-wrenching situations. Gianna was intubated right at birth and remained on a ventilator for 3 weeks, followed by various other oxygen supports for 18 weeks. Additionally, Gianna had chest x-rays, blood draws, heel pokes, IV insertions, head ultrasounds, echocardiograms, eye exams, 3 blood transfusions, and a long journey of learning how to feed. That's just a brief picture of the intensive care that Gianna received at Foothills NICU. Those 149 days were hands down the scariest days of our life as we watched our daughter fight to survive. The NICU staff was there to support us every step of the way as parents. They provided resources to care for our mental health. The staff empowered us to be part of big medical conversations daily. They stood with us in our toughest hours and truly became our family. The nurses advocated on our behalf for our daughter when we couldn't be there in the hours of the night. And they taught us, the nurses taught us how to care for a baby as fragile and tiny as Gianna, which meant learning how to change the diaper of a 1 pound baby who was covered in wires and tubes. That's just a brief picture of how much they mean to us. The nurses even took the time to scrapbook. They took pictures of Gianna and scrapbooked and made a keepsake for us that we will cherish for a lifetime. Today, as you can see, Gianna is a much healthier 1-year-old. But prematurity doesn't just magically end the moment that you leave the NICU. Once we left the NICU, we had to navigate constant appointments, using medical equipment in our home, and several medications. Gianna used a nastrogastric feeding tube, that's a feeding tube through the nose, to help meet her nutrition needs for 6 months after discharge. She spent 3 months in the fall, again on oxygen, to help her lungs because they're so fragile due to being born so early. It truly is an ongoing battle. We will never forget the care that our family received in the NICU. The NICU gave us the family that we are now. They gave us our miracle baby Gianna. And while they did it, they became family to us. The NICU gave us this magical day of bringing her home after 149 days, which was the most surreal day of our lives. We cannot express our gratitude enough for the Foothills NICU and the importance of the care that is going on there. These babies are our future. Thank you very much. Have a nice day.
Go to questions. One question, one follow-up. Operator, can you please put through the first caller?
I think I heard you there. We are getting a very weak signal coming from the feed, but if it is time for questions, our first one's going to be from Kevin Nimick with CTV Calgary. Go ahead, Kevin.
Hi there, this is a question for Minister Shandro. You're highlighting investment in health infrastructure projects today, but Budget 2021 strips funding for public sector workers. If Alberta builds new health facilities, who's going to work in them?
Kevin, we are continuing to invest in AHS and making sure that AHS has all the resources that it needs, from equipment to facilities to its workforce as well. And if there are any questions about the conversations that Minister Toews' office will be having with our public sector unions, I defer it to him. But we have made it very clear that throughout the pandemic, resources are not an issue for AHS to be able to respond to the pandemic. And we're going to continue to make sure that this is a health system that, and let me point out as well, that the reason we've been able to make announcements like this, the reasons we could make announcements like the funding of Zolgensma, the reason we could in August make an announcement regarding the funding of new therapies like CAR T-cell therapy, is because we have pushed AHS to be more efficient in how they spend their dollars, and the health system as a whole, and how it's spending its dollars, so that we can provide more care with the same amount of money. And on top, we are also funding $900 million more in this healthcare budget, so we can increase the care that people receive throughout the province. Thank you, Kevin.
What?
Nearly 17,000 surgeries and procedures have been postponed in Alberta during the pandemic. Is this still happening, and what's being done to catch up on missed appointments?
A fantastic question, Kevin. We, in the spring, went down as far as 40% of our pre-COVID surgical capacity. Now, it wasn't as bad as other provinces. I know Ontario went down to as much as 10% of their pre-COVID surgical capacity in the spring. But we have pushed AHS, and that included during the summer, to be able to catch up on 90% of that backlog that occurred during the spring. We did see in Edmonton some postponement of surgeries and treatments that happened in the fall. Our commitment is to making sure that it's a multi-pronged approach, Kevin, to be able to make sure that in AHS, in those operating rooms, as well as our chartered surgical facilities, that we're getting more volume in this fiscal year, as well as the next fiscal year. And eventually, when the pandemic is done, to be able to do 50% more surgeries. So we will be getting AHS and our chartered surgical facilities to doing 150% of our surgical capacity that it was before COVID. And that's because we are still committed to meeting the targets that we made to Albertans in the last election, to getting our surgical wait times down to, for most surgeries, down to 4 months. What doctors call clinically appropriate wait times, which no other province does. We're still on track to be able to make that commitment, because we are, as we announced last year, investing $100 million in the operating rooms in AHS, and to be able to make sure, and throughout COVID, we have 5 dedicated hospitals, the Royal Alec, Westlock, I don't remember the other 3 off the top of my head, dedicated to surgery, so we can use innovative ways of increasing the surgical capacity within AHS during the pandemic. Thanks, Kevin. And I should mention too, with COVID, it's not even just a matter of the beds for people to be able to receive treatment after a surgery, but every surgery takes longer during COVID. That COVID has added and made it more difficult for the same volume of surgeries to be done, because our nurses and our doctors and everyone else involved have to do so much more in between during the surgery. So it is difficult, but AHS is doing amazing work to be able to keep up with the surgeries that need to be done for Albertans.
Operator, can you please put through the next call?
Next is Dean Bennett with the Canadian Press. Go ahead, Dean.
Thanks very much. Afternoon, Minister. I realize it's just been 24 hours since the 4-month lag announcement was made, but I'm wondering if you can tell us how that might change the practical rollout of the vaccine. So, for example, could you maybe do all 4 stages of phase 2 at once, as opposed to rolling it out sequentially?
You're talking about Dr. Hinshaw's announcement yesterday and the effects that's going to have? We'll be making... Okay, yeah, we're going to have an announcement this afternoon. Dr. Hinshaw and I will be making, providing more clarity on what that's going to mean for the vaccine rollout from now until June, as well as the consequences for folks in phase 2. So we look forward to being able to provide that update in a couple hours. Dean, do you have a follow-up?
Yes,
Sorry.
Minister, just quickly then, on the given the 4-month rollout now, will that affect how we do the economic lockdown rollout? And how soon could we see some of those restrictions perhaps lifted?
Well, we are going to, again, review this week's data when we review as a committee, the Cabinet COVID Committee next Monday, seeing if the leading indicators that were a concern for this week continue to be a concern, or whether we can proceed with the remainder of step 2. So we'll be able to review that data with Dr. Hinshaw in our office and the ministry folks at that time. And as well, like we've said to Albertans since we first announced the Path Forward plan in January, we want to focus the stepping down of measures on the lagging indicators. The hospitalizations still are lower than what would be indicated for step 2 at this time. So that's good news. The concern, though, right now is the leading indicators, which was whether we pause backing down a step, or if we ever had to impose new measures. We hope that doesn't become the case. So we're going to monitor those leading indicators carefully at the next meeting. But I think, look, as we have vaccines, now we have a predictable and stable supply from what we've told by the federal government for March, which is good news. We have a third vaccine now being approved by Health Canada, good news. And quite frankly, more vaccines are going to mean an ability to get to step 4 quicker for all Albertans. So this is good news for us. Hopefully, we can all hold the federal government to account in making sure that they stay to these allotment tables for the remainder of Q1 as well as Q2, so we can have these economic measures step back. And our hospitalizations as well as our case numbers don't become a concern for us.
Operator, can you please put through the next caller?
Next is Chris Epp with CTV Calgary. Go ahead, Chris.
Thank you, Minister. Given that the vaccines are coming, we've got more time between them. Do you see any sort of expedition as far as allowing fans into professional sports events in the States? NHL teams, a few more are letting in fans this weekend. I know the Oilers and Flames are both discussing this with the province. I guess, how do you see that playing out? Do you see that as being feasible, that in some limited capacity fans could be at hockey games this season and maybe football games by the summer?
Well, I'll say a couple things, Chris. I mean, first, that we have contemplated this. This is something that would be included in step 4. So once we get to step 4, this is something that we would be permitted. We look forward to getting to step 4, just like all Albertans do. But also, there are leagues who have approached Dr. Hinshaw. The NHL was one in 2020 for the Stanley Cup bubble, who've come and tried to work with her office and being able to work towards having a bubble, the curling championships as well. I understand that as well, that the football leagues in Alberta are going to be approaching Dr. Hinshaw as well, to seeing how best they can be able to work within the public health measures and the concerns that Dr. Hinshaw's office have. So I encourage those folks to continue to have those conversations with their office. But the details of how and when there might be accommodation for something like that, I defer to Dr. Hinshaw. So perhaps this afternoon, Chris, when I am presented with Dr. Hinshaw.
Do you have a follow-up?
Yeah, thank you. I guess just to pin it down, though, I know step 4 was the original timeline on allowing sports and concerts, indoor events with people, but is there a window here for an exception to be made to that, with the idea of having limited fans? Like I guess are pro sports bound to those steps, or is there talk of finding workarounds for limited capacity?
Maybe in a couple hours when I present with her on the vaccines. Thanks, Chris.
Operator, can you please put through the last caller?
Yeah, our final question today is Rick Bell with the Calgary Sun. Go ahead, Rick.
Yeah, it's very hard to hear you on your end, so I don't know what you can do about that. But question for Minister Shandro. It's kind of a two-parter. Number one, what is it going to take for you in the government to not be worried about the rocket ship taking off and the hospital system becoming overwhelmed? especially given the fact that right now those rocket ship projections are we're nowhere near those. So what will it exactly take for you to implement the rest of step 2? Like, how high a bar does there have to be met in the next week or so? And more importantly, what do you think of the pushback from many members of the public and from UCP MLAs publicly against the decision Monday, since I think the expectation of a lot of people was when you have 250 people in hospital, you should surely be able to meet a measure where 450 people are hospitalized. So maybe if you could answer those two. What is your reaction to the public and political pushback, even from your own benches? And what is it going to take, Minister, for the government to finally say, no, we have enough confidence to say there are not going to be body bags in field hospitals in the next 6 weeks?
Sure, thanks, Rick. And I'll maybe talk a little bit closer to the microphone if that's a little bit better. Adam, sorry, I touched the microphone. Hope that was okay. So, Rick, first, what would it take? Look, I go back to what we originally announced with the Path Forward plan. And what we originally announced was focusing on the hospitalizations for the stepping down, but also making sure Albertans knew that there could be pausing of a step or the implementation of further measures if we saw growth in cases. We can't impose further measures or have the pausing of a step based on a lagging indicator, because it takes 2 weeks for someone to not just contract COVID, but another 2 weeks then after them for them to be able to usually need treatment in a hospital bed. So you can't look at the lagging indicators for something like that. So we saw 8% growth over in a weekly average. That was a concern. So that was enough for us to say, look, parts of this, we are going to proceed. We're going to proceed with ones that we thought were the smart and safe ones to proceed with. But some of them we are going to hold back on. Take a look at where the increases are happening, where the sources of transmission are, if they can be traced back, and try and figure out if they are caused by anything from step 1, if there are any concerns, or if there aren't concerns, then let's proceed with the rest of step 2. So it was a matter of us saying, for a week, we need to look at another week's worth of data for the rest of that step 2. I think we try to make it that clear. Happy to make it clear again. You asked then the second question about what do I say about folks who are frustrated. Rick, I say this, I'm there too. I'm frustrated. Everyone is frustrated. I say this as well, not even just the sympathy and the empathy that I have for people who are sick and tired of the measures, who are frustrated with the measures. Remember, we're not in this alone. The rest of the world is also going through this. The rest of the world is also grappling with the consequences of health measures. That's one of the reasons why we have made sure, unlike other jurisdictions throughout the world and in Canada, for our measures to be targeted and as narrow as possible, and for us to make accommodations because we are balancing the social and the economic consequences of these health measures. So we're not in this alone. The rest of the world is going through this too. And the third thing I'd say to folks who are frustrated is, look, we wouldn't have increases in these cases if February didn't have the type of vaccines that we ended up having delivered to us. So I encourage those folks who are frustrated, let's direct our frustration to the federal government so that they do not pull the rug out from under us in March like they did in February. Let's hold them to account, make sure that those vaccines we've been told we're going to receive in March come. The reason the people are frustrated with not all of step 2 being announced this week is because of that increase. So let's make sure we get the vaccines we've been told we're going to get in March. Let's get those vaccines out. We're going to then continue to see cases not being a concern, or hospitalizations staying stable, if not still coming down, and we can get to step 3 and step 4 as quickly as we can. Because we are all frustrated, Rick. All of us are. So I have a huge amount of sympathy for anybody who's frustrated, because we all are. Thanks, Rick.
Thanks. We'll wrap it up there for the photo. Thanks.